KPBS news partner iNewsSource found out how many kindergartners in San Diego County are not vaccinated for measles, mumps, polio, and whooping cough. iNewsSource reporter Joe Girardi and family medicine doctor Ellen Rodarte with Sharp Reese Steely Medical Center join us with the details. And Joe, using data from the State Department of Education and California Department of Public Health, you actually put together an interactive map showing the vaccination rates among kindergartners in San Diego County. Walk us through what you found.
Sure. There's nearly 560 kindergartens, both private and public, in San Diego County. We put them on the map and then we joined them with vaccination rates. So what you can see here are the green dots are the dots where the vaccination rate is above the county average of about 94%. The red dots are the ones where that vaccination rate is actually below that. So you can search by the name of the school, you can search by address, and you can actually filter by the vaccination rate, and then you can zoom in and you can pick out any school you want. So let's just take this one totally at random, click on it right here, the children's school, and you can see that their up-to-date students are about 92% and they've got an 8% exemption rate.
How do these rates compare to the previous year?
So they're down slightly from the previous year in terms of the exemption rate. This year, it's about 7.6% of students aren't fully up to date with their vaccines. Last year, it was a little below 10%. However, those numbers are both more than they were a decade ago when the rate was below 6%.
So, Dr. Rodardi, so slightly more kids are vaccinated these last couple of years. If that's true, why is the medical community still concerned about vaccination rates?
Well, we want all children vaccinated because we want to protect all the children from these diseases. And herd immunity is an issue for certain ones, but we want children to be immunized for things that aren't as critical herd immunity-wise. Hepatitis B, rubella, all these diseases, we want children immunized for all of them.
And there's still serious illnesses. You can still have serious complications.
Yeah.
Give us a few ideas of some of the things that can happen if you're not immunized and you get one of these infections.
Right. When I have a family come in their mind, they think their child is healthy and they don't need these immunizations. In my mind, and with my colleagues, we've seen these diseases. I've seen liver disease from hepatitis B. I've seen families devastated by congenital rubella. So anyone in medicine knows that these are real diseases that happen and affect families and affect their lives. So we want all of our children protected from them.
And Joe, you actually spoke to a woman who says that she won't vaccinate her 4-year-old son. Let's see what she told you.
There are people out there who are going to be watching this, and when they hear you say these things, they're going to think, she's a bad mother. She's endangering the life of her child.
Or their child.
Or their child.
I've heard that one the most.
What do you say to them?
I just acknowledge myself for my choices. I don't say anything to them. If they are invested in their point of view, then that will be their point of view. And I'm not going to defend mine or try to prove my point of view. It's just a choice that I continue to make.
So she's saying she's making this choice, she's not defending it. If you were to counsel a patient who had similar belief systems, what would you tell them?
Well, first, I do anything I can to convince them to immunize their child. If I got on the floor on my hands and knees and that would get them to immunize their child, I'd do it. But if I can't, then I do remind them that they should not have that child travel. That child should not be around children under the age of 1 year.
Because?
Because they can spread disease to children whose families don't have the choice to be immunized. And those symptoms can manifest and be spread before the family realizes they have it.
I see. Now, Joe, you looked at data, this vaccination data from both public and private schools. Were there any trends or correlations that rose up when you were doing this?
Yeah, there sure were, Peggy. So we looked at private versus public kindergartens and found that there was a noticeable increase at private kindergartens among students who took advantage of these personal belief exemptions and didn't vaccinate their kids versus public schools where the rate of personal belief exemptions were much lower. We also took a look just at public schools, comparing ones with high percentages of students who qualify for free or reduced meals to low percentages who qualify for free or reduced meals, and we saw a large disparity in terms of the schools with wealthier populations having higher rates of these personal belief exemptions.
Okay. iNewsSource Joe Girardi and Dr. Ellen Rodarte, thanks so much for the update. And I want to let folks know that they can use your iNewsSource interactive vaccine map just by going to kpbs.org. Thanks again.
Thank you.
Thank you.